still on the crash SCA preparation. So the SCA has started today, so let's carry on. Let's have a quick look at what the BVLA has to say as regards certain conditions in driving. Let's look at seizure. Scroll down to seizures. So let's look at seizures. So for group 1, license holders, which are people who are driving cars and are licensed to drive cars and motorcycle. Group 2 is bus and lorry. So if a person has had epilepsy, the person has epilepsy, which means the person has multiple unprovoked seizures, then the person must not drive and must notify DVLA. So the patient has been diagnosed with epilepsy, they must not drive, whether they hold a group 1 or a group 2 driving license. They say driving must cease for 12 months from the date of the most recent seizure, unless the seizure meets legal criteria to be classified as a permitted seizure. Obviously, then that's something that the DVLA would, or working with occupational therapists and maybe the neurologists, who have to define what they mean by permitted seizure. For a group 2 license holder, the person with epilepsy must remain seizure-free for 10 years before licensing may be considered. The truth is that in the SCA, I bet you most of these numbers will fly out of the brain. But the most important thing is to understand that, okay, this person should, you're going to double check on the DVLA website or guidance and get back to them. That will also I encourage them to seek advice or guidance from the DVLA themselves as well. Now, in the SCA, it could be a patient who has had a first unprovoked seizure, isolated seizure episode, and the question is, what should you be telling them about driving? Must not drive and must notify DVLA. So if you have a first seizure, you must not drive, you must notify DVLA. Now, driving must cease 6 months from the date of the seizure, or 12 months if there is an underlying causative factor that may increase risk. For instance, if the person is diabetic and likely had a hypoglycemic episode, had a seizure, as long as they carry on being diabetic, they might need to be off driving for 12 months until they had the seizure. As for a group 1 license holder, for a group 2 license holder, obviously they must not drive and must notify DVLA if they've had an isolated seizure or when they've had epilepsy seizures. Driving must cease 5 years from the date of the seizure. So you can see it's much longer because if a group 2 license holder has an accident, the impact is usually or could potentially be much worse than. So imagine a bus having lots of passengers having an accident. The impact is potentially going to be more than a car, who is probably going to have 1, 2, at most maybe five people within, but a bus could have 30, 40 people. Or a lorry, having an accident, the impact a lorry will have if you collide with a smaller car will be less than the impact to have if a motorcycle collides with that same car. So usually, the license restrictions or driving restrictions on the 2 license holders when they have health conditions that potentially could put them at risk or put other road users at risk. The license restrictions are usually much heavier. For provoked seizures, except related to the use of alcohol, the individual must not drive or must notify. So whenever a patient comes to you with seizures, they must not drive and they must inform the DVLA. In terms of how long they will have to be off driving, in SCA, you don't need to commit because I bet you most times in under exam conditions, those numbers will all mumbled within your brain. So most likely, I advise you not to drive. I'll double check with DVLA guidance to see exactly how long you're likely to be off the road for. But obviously, I'll advise you to contact the DVLA and speak with them and get more clarification or further clarification on how long you should not be driving for. You need to explain to the patient it's all about safety for yourself and for other road users. Because if you have this seizure while you're driving, and obviously the impact can be catastrophic to both yourself and other users. So it's about explaining the safety concerns. Now let's look at hypoglycemia. So it's hypoglycemia. So I'm going here. Okay, quicker this way. So let's look at hypoglycemia. If a patient has had a hypoglycemic episode, what was the driving guidance? For a group 1 license holder, I say all the following criteria must be met for DVLA to license the person with insulin-treated diabetes for 1, 2, or 3 years. So if you have type 1 diabetes, you need to have adequate awareness of hypoglycemia, no more than 1 episode of severe hypoglycemia while awake in the preceding 12 months, and the most recent episode occurred more than 3 months ago. The patient practices appropriate glucose monitoring as defined in the box below, not regarded as a likely risk to the public while driving, meet the visual standards for acuity under regular review. So, as you can see, under regular review, which means things can still change. And that's why you need to always tell the patient to speak with the VLA and get further guidance. The patient is on insulin, they must have, okay, a diabetic patient, they must have awareness of hypoglycemia. So, if they don't have a hypoglycemic symptom awareness, then that's likely a problem, because what it means is that they're driving and they're becoming hypoglycemic. They may not sense it until they go into a coma and lose consciousness, and they go into a coma, then have a crash, which would obviously endanger themselves and other users. For a group 2 license holder who is insulin dependent, who has insulin dependent diabetes, all the following criteria must be met for DVLA to license the person with insulin treated diabetes for 1 year. Full awareness of hypoglycemia, no episode of severe, no episode, you can see, no episode of severe hypoglycemia in the preceding 12 months. The question is, what is severe hypoglycemia? We defined here. I did give a value. So obviously we said hypoglycemia is when glucose is 4.0 or below. They haven't given a value for what they mean by severe. They just mean very symptomatic. They can't give any value if it's less than 3, if it's less than 2.5 millimole per liter, or if the patient loses consciousness, becomes delirious. They've not defined exactly what they mean. So the patient for group 2 license holder, the patient has to practice blood glucose monitoring with the regularity defined in the box below. The patient must use a blood glucose meter with sufficient memory to store 3 months of reading at the table below. But that obviously, if there are things happening, you can always present and show everything that your blood glucose has not been within the hypoglycemic range in the last 3 months. The patient or the person should demonstrate an understanding of the risk of hypoglycemia, no disqualifying complications of diabetes, as well visual impairment, diabetic foot complications where you probably have hypoesthesia, anesthesia of the foot, and you can't really feel your pedals very well. But things like that. So essentially for diabetes, because it has to be, it's people that are usually in type 1 diabetic that are obviously more prone to hypoglycemia because they're on insulin. Of course, if your patient is type 2 diabetic and is also on sulfonylureas, which are also notorious for causing hypoglycemia, then obviously they need to be speaking with DVLA for guidance. So you can see here recurrent severe hypoglycemic guidance. Person must not drive and must notify the DVLA. DVLA will then carry out medical inquiries before a licensing decision is made. That's for group 1 license. For group 2, person must not drive and must notify the DVLA of all episodes of severe hypoglycemia. Now, all group 1 and group 2 drivers will experience an episode of severe hypoglycemia while driving must not drive. You must notify the DVLA. Hypoglycemia unawareness. For group 1, the person must not drive once it's 5 DVLA, DVLA, same thing. So if a patient is diabetic and they don't have hypoglycemia awareness, they don't get the warning symptoms when hypoglycemia begins to set in, then they should not drive. For group 1, the driving may resume after a clinical report by a GP or consultant diabetes specialist confirms that adequate hypoglycemia awareness has been regained. For group 2 license holders, the person must not drive and must notify the license will be refused or revoked. So it's not even going, it's going to be revoked. Obviously, that shows you that the government doesn't joke with group 2 licensing, especially because of the safety impacts. Imagine a driver, a bus driver carrying school pupils or school students to school, goes into a hypoglycemic coma, loses consciousness, and crashes that bus. And imagine 10 students die from such an incident. You can see why group 2 license restrictions are very strict when they have health problems that could impair driving safety. In the SCA, for instance, the patient is having diabetic eye complications. You need to be checking if you're driving. And if yes, obviously, you need to advise them not to drive and you should speak with BVLA. Because you need to explain why, because I'm concerned about your safety and obviously safety of other road users. If by any chance you could carry on driving and with your visual impairments, and always need to check, do you understand why I'm advising such, for instance. So let's look at TIA. Ischemic. So British spelling. Look, transient ischemic attack. Let's look at what the DVLA has to say. So this is stroke and cerebral venous thrombosis, single transient ischemic attack. Let's have a look. So the patient has had a single episode of a TIA. They must not drive for 1 month, but need not notify the DVLA. If it's a group 1 license holder, for a group 2 license holder, if you've had a single episode of TIA, you have to still inform the DVLA. Because if you look at this, let me zoom out. If I zoom out, you can see the demarcating line. You can see that for group 2 license holder, whether you've had a stroke or single TIA or multiple TIA, this applies to everybody. And let's read what they're saying there. So for group 2 license holders, if you've had a stroke or you've had one or multiple episodes of TIA, you must not drive and you must notify the DVLA against it because of the impact of the impact an accident involving someone who drives a bus or a lorry is going to have if they had a stroke while driving or if they had a TIA while driving. A license will be refused or revoked for 1 year following a stroke or TIA. Relicensing after 1 year may be considered if there is no debarring residual impairments likely to affect safe driving. So it's all about safety. You're not punishing your patients. You need to make it clear to the patient that you're not trying to punish them by telling them to speak with DVLA, because once you tell the patient to speak with DVLA, they know what's going to happen. They know that their driving license is already being threatened. There's a likelihood DVLA may advise that they should not drive for 6 months, for 1 year, or might even revoke their license completely, which means they will never be able to drive. If it's a group 2, for instance, they might never be able to drive hold a group 2 license, but they might still be able to carry on with a group 1 license. It's all depending. And if patients panic, when you mention DVLA, you need to learn how to explain to them that it's all about safety for themselves and for other users. And you should get further advice or guidance from the DVLA. So still on group 2, so licensing may be subject to a satisfactory medical report, including results of exercise, ECG testing. The condition is cerebral venous thrombosis, or there's imaging evidence of less than 50% of carotid artery stenosis. and there's no previous history of cardiovascular disease, the license may be issued without the need for functional cardiac assessment. Patients with recurrent TIAs or strokes will be required to undergo functional cardiac testing. Functional cardiac testing. So the TVLA can help arrange all of these, by writing letters to both the patients and the GP or the cardiologist, for instance, as the case may be. So if you for a group 1 license holder, because to bring in some complexity in the SCA, the patient might be a lorry driver or a bus driver. So already he's a group 2 license holder. So if he has any problem that will impair his safety, likely we'll tell him our advice, because you're a bus driver, our advice that's because you're a bus driver, and if you have these episodes while you're driving, the impact is likely to be massive or fatal. Advice was you avoid driving. In the meantime, I'll speak with the DVLA to get more guidance on driving safety. And once you put it that way, you're not condemning the patient. The patient doesn't feel like you're condemning them to using their license. They understand where you're coming from. Yes, they might be afraid of giving up their license, but then they understand you. Obviously, they're reasonable. They'll seek, they'll heed that advice. Now, for stroke, cerebral venous thrombosis, venous thrombosis for group 1 license holders, the person must not drive, but may not need to notify the DVLA. So if someone who drives a car motorcycle has had a stroke, there's a possibility they may not need to notify the DVLA. But if you're approaching it in SCA, what's he going to say? I'll advise you not to drive. I'll advise you to get guidance from the DVLA as to whether it's safe for you to carry on driving. You're not going to tell them you can carry on driving. Seek guidance from the DVLA. There's still a chance you might be able to carry on driving. If not, they might tell you how long you need to stay off driving just to make sure you remain safe before you can resume. So it's about flexibility. You're not going there to give them numbers. You must be off the road for 1 month. You must be off the road for no. But let's have a look at what the DVLA advises anyway. So driving may resume after 1 month if there has been satisfactory clinical recovery. DVLA does not need to be notified unless there's residual neurological deficit 1 month after the episode. And in particular, which means obviously the person should be off driving for at least 1 month to make sure that every neurological deficit that they may have sustained from a stroke has resolved and is not recurring again. Unless there is residual visual field problems, cognitive deficits, impaired limb function. Now, minor limb weakness alone after a stroke will not require notification to TVLA unless restriction of certain types of vehicle or adapted controls may be needed. Now, some of these things are quite tricky because if a patient is asking you, doctor, do I need to inform the DVLA when they're having some mild residual neurological deficits? Of course, as a doctor, you can't tell them no. Because if something happens, if they have a crash, they'll say, well, my doctor told me I can carry on driving, and the whole blame will be heaped on you. So you have to know how to answer this kind of questions. That, well, there's a possibility you may be safe to carry on driving. However, I advise you speak with the DVLA to get more guidance on whether it's actually safe for you to carry on driving. Okay. Seizures occurring at any time of a stroke or TIA or in the ensuing first week can be treated as provoked for licensing purposes, provided there is no previous history of unprovoked seizures or cerebral pathology. Such provoked seizures will require, so we've already looked at the provoked seizures. Obviously, if you had a seizure, you need to still speak, you must stop driving and you must get guidance from the DVLA. We've looked at that. What if someone has had an MI? Someone has had a myocardial infarction. How does it affect their driving? Let's have a look. Acute coronary syndrome to include type 1 and type 2 myocardial infarction, which should be the STEMI and non-STEMI. That could subocardiomyopathy. So let's say it's a patient in the SCA or even real life patients have MI. And they've been discharged from hospital and they're coming for their follow and they want to talk about driving. You get driving guidance. What do you tell them? So for group 1 license holders, they must not drive, but they need not notify DVLA. They need not doesn't mean they should not. It means they may not if they choose not to. Driving may resume 1 week after an acute coronary syndrome if successful coronary intervention, the PCI, and if all of the following are met. If no other urgent revascularization is planned, urgent means within the next 4 weeks of the acute event. If the left ventricular ejection fraction is at least 40% before hospital discharge, if there is no disqualifying condition, if not treated by successful coronary intervention or any of the above are not met, driving may resume only after 4 weeks from the acute event, provided there is no other disqualifying condition. So it's actually good to have this information at the back of your mind. That's MI. The driving restriction period is usually within weeks, it's usually a short one. If they've had a PCI and obviously they've met these other criteria, which in the SCA you might not really remember all at once because no matter how calm you try to be, there'll still be some level of adrenaline in your body telling you this is actually an exam, which is going to be scored. So you need to sit up. Your brain at that point will not just be able to remember all the numbers in terms of weeks, and you might not remember the ejection fraction being at least 40%. So at that point, you tell them that not particularly sure at this point in time in terms of the driving safety restrictions, if there are. However, I will double check that after this consultation and get back to you on that. At the same time, I advise you speak with DVLA or the professionals in driving assessments to get further guidance. For the Group 2, a Group 2 license holder who has had an MI or any other forms of acute coronary syndrome, and they have Takotsubo cardiomyopathy, they must not drive and they must notify DVLA all ACS. License will be refused or revoked. They may be relicensed or licensed after at least 6 weeks if the requirements for exercise or other functional tests can be met. If the left ventricular ejection fraction is at least 40%, and if there's no other disqualifying condition. No functional cardiac test is required in Takotsubo cardiomyopathy in the absence of known coronary artery disease. So still again, they say to be refused or revoked, but there's still a chance that they could get back the license. So if patients could say, "Oh, doctor, I've just been discharged. I just had a craft, or I just had a bypass, a cardiac bypass." What then happens in terms of driving? What should you be telling them for Group 1 license? They must not drive for at least 4 weeks, but need not notify the DVLA. Driving may resume after 4 weeks, provided there is no other. To be on the safe side again, check how they're recovering, how well they're doing, if they're having any syncopal or pre-syncopal episodes, if they're having controlled chest pain post-op, they're having any troubles, essentially, how they cope in terms of the exercise tolerance, and then in terms of driving safety, you can double check with on the DVLA guidance and get back to them after that consultation. And you also advise that you can also speak with the DVLA to get further guidance, just to clarify driving safety. It's all about safety. No, you're not punishing your patient. It's all about safety, okay? Because if anybody is not safe on the road, anyone can be a victim. So because the way life is, if that patient who is not safe carries on driving, it might be that you, the doctor, on your way home after your consultation, that patient will lose consciousness and crash into you. Maybe both of you will die. So anything can happen. Anybody can be a victim when things are not done right. I think something. So for the cabbage, patients who have undergone cabbage coronary artery bypass graft, the Group 2 license holder, must not drive and must notify the DVLA. License will be refused or revoked. May be relicensed or issued after 3 months if left ventricular ejection fraction is 40%, requirements for exercise or other functional has been met, and there's no other disqualifying condition. Won't remember all of this, but if your brain is a magnet, I said if it's something that you've been doing, if you've been working as a DVLA, assessor, for instance, and you've got that experience, then obviously you might be used to it. Otherwise, there's really no point in trying to memorize or cram these numbers without applying knowledge to show that you understand that there's a driving safety which could potentially be an issue. What else could typically happen coming in? So let's look at lightheadedness, dizziness. Because dizziness is another thing that could you could experience when encountering the SCA, so dizziness. Patient is having dizzy spells, so we against TIA, with stroke, with hypoglycemia. Look at the patients who's had a cabbage. When the patient was having cardiac infarction in terms of driving, so like nothing that commonly could affect or could be driving consent, driving safety concern. Maybe SCA could be a patient who's presenting with dizzy spells, giddiness. In terms of driving, have a look. The dizziness, liability to sudden and unprovoked or unprecedented episodes of disabling dizziness. Okay, so it's all about how severe, especially if it's happening when the person is driving, even if not happening when driving. The sudden is defined as without sufficient warning to allow safe evasion action when driving. And disabling is defined as unable to continue safely with the activity being performed. For group one and group one, car, motorcycle license holders, the person must not drive on presentation and must notify the DVA. When satisfactory control of symptoms has been achieved, the licensing may be considered for restoration.